Hi, I'm Dr. Larry Malerba, and this is All Things Homeopathy. Today I'm going to be talking about suppression. Most people think of suppression in immunologic terms. Suppression is thought to be a type of weakening of the immune system, which can result in greater susceptibility to microbial invasion. While this is partially true, suppression needs to be understood in its much broader context. In the last episode, I explained that from a homeopathic perspective, all symptoms have a purpose. All symptoms are expressions of an imbalance of the underlying vital energy that animates each human being. The life force is a much more comprehensive concept, one that includes the immune system and all other homeostatic mechanisms. All symptoms, even physical symptoms, are surface manifestations of a deeper energetic disturbance of the life force. From this broader perspective, anything that inhibits or adversely affects the life force can be considered potentially suppressive. The life force always manifests its distress in the most favorable way possible, given the parameters of each individual situation. A strong life force will focus its energy toward the periphery, thus generating relatively superficial symptoms. As the life force weakens and becomes compromised, illness manifests on deeper levels. A comparatively healthy life force will tend to generate less threatening symptoms. A more compromised life force tends to generate more serious symptoms. Normal, healthy babies tend to get diaper rashes, stuffy noses, and fevers. In contrast, some less healthy adults tend to complain of symptoms such as headaches, stiff joints, and bouts of sleeplessness. Adults with more compromised states of health tend to develop high blood pressure, chronic fatigue, and mood disorders like depression and anxiety. There is a general hierarchical relationship in terms of the way that disease tends to progress. Symptoms develop roughly from surface to interior in this direction, from the physical to the emotional to the mental and finally to the spiritual. Examples of symptoms that illustrate these different levels are diarrhea, anxiety, forgetfulness, and hopelessness. As the life force weakens, illness tends to manifest on progressively deeper levels. The larger point that I'm making is that the unacknowledged reality is that suppressive treatments tend to accelerate this progression. Suppression drives illness deeper into the system, thus causing it to mutate into more serious problems. And the problem is that almost all allopathic drugs are suppressive in nature. That's why they call them antacids, antimicrobials, antihistamines, anti-inflammatories, and antidepressants. They act by thwarting the efforts of the life force to heal itself. When prevented from doing so, it's as if the life force responds by saying, well, if I can't have those symptoms, I'm going to give you this new, more serious problem. So when symptoms are suppressed, the life force simply looks for other ways to express the underlying imbalance. Sometimes it takes the form of more serious physical symptoms. In many cases, the disturbance metastasizes to another deeper level. Symptoms can easily jump from one level to another. When deprived of an outlet on the physical level, the energetic disturbance can resurface on the emotional or mental level. Since conventional medicine never acknowledges this phenomenon, it fails to take responsibility for the role it plays in encouraging the development of chronic disease and psychiatric illness. Let's take a look at a few simple examples. A person taking migraine medication experiences fewer migraines, but then begins to complain of fatigue. A topical antihistamine relieves the itching of a child's diaper rash, but soon thereafter the child gets its first ear infection. Birth control pills bring relief from a young woman's painful periods, but she starts to notice mood changes and loss of libido. Hypertensive drugs help to normalize a man's high blood pressure, but he begins to complain of lack of motivation. In each example, the new problem is either deeper or more serious than the original. Examples like this tend to be the rule, not the exception. Allow me to paint a picture of a medical scenario that has reached epidemic proportions. Sam is a healthy toddler with a small patch of eczema. Sam's parents apply topical cortisone cream. The eczema vanishes, and within a couple weeks, Sam develops an ear infection. Over the next couple years, he develops 5 more ear infections, and each episode is treated with antibiotics. All the while, Sam's demeanor becomes more grumpy and whiny. He becomes picky about the foods he's willing to eat. By the age of 5, Sam develops the first in a string of annual bouts of bronchitis, which also require antibiotics. When the pediatrician detects wheezing, Sam is prescribed an inhaler to use. Sam then begins to complain of stomach aches, and he becomes even more finicky about his food choices. He rarely eats anything other than hot dogs, chicken fingers, and pasta. Sam begins to miss school days due to stomach pain. His doctor prescribes an acid reflux drug. His parents subsequently discover that he's not completing his homework assignments. Frustrated, Sam's parents consult another doctor who suggests a trial treatment with an antidepressant. Sam improves briefly, but then takes a turn for the worse. He begins acting out in school, fails several exams, and winds up in detention more than once. His doctor changes his prescription to an attention deficit medication. I think by now you get my point, so I'll stop here. As a general strategy, suppressive treatments often result in very poor long-term outcomes. When we consider that almost all drug therapies are fundamentally suppressive, the implications for our collective health are staggering. On the other hand, methods that respect the intent of symptoms and work with the vital energy rather than against it tend to produce far more favorable outcomes. Genuine healing works in a direction opposite to suppression, and I'll be talking more about that in the next episode of All Things Homeopathy.